Hi, my name is Alan Wong, and I'm an MD PhD student at Boston Children's Hospital, and I'm a recipient of the Drug Discovery Predoctoral Fellowship. So I started my research career in college actually working with axolotls, which are these adorable aquatic salamanders. And what's amazing about axolotls is that they have this remarkable ability to regrow really any organ in their body, including their limbs. And I was really inspired by the question of how amazing things like this happen in nature and to try to understand the beautiful features of this process. I was really inspired by the excitement of uncovering something unknown. And I find that a lot of work in science is uncovering patterns like this in nature, but also trying to identify things that don't fit the mold and trying to understand why that's the case. I think as a scientist, what excites me most is when you see something that doesn't quite make sense. And if I can't figure out why, it's like having an itch in your brain that just won't go away. And I find that it's kind of like unraveling a ball of yarn or trying to solve a really difficult puzzle. And I just really want to keep going until I can figure it out. So the focus of my work is to develop new therapies for kids that develop blood cancer or leukemia. Blood cancer is the most common type of cancer in kids. And in many kids, this blood cancer actually spreads to the brain. And this is a complication that can be quite deadly and devastating for these kids. And so although our current treatments for leukemia or blood cancers in the brain are quite successful, some of the long-term survivorship studies are finding that these treatments are probably causing damage to the healthy brain. And as a result, most kids don't achieve a great quality of life in the long term. And so my work has identified a new potential way to potentially enhance the effect of leukemia therapy by using nutritional and dietary changes. And in fact, we found that by lowering the levels of the micronutrient copper in the diet, we can actually enhance the effect of existing leukemia therapies. Although our current studies have only included animal models of leukemia, we're very excited about the potential implications for human patients in the future. The metabolism of these trace metals has been overlooked for a long time. It's relatively difficult to study because they're kind of everywhere. Proteins like meat, particular organ meats, are also high in copper, so like liver, kidney. Beans also have relatively high levels of copper. In the past couple of years, there's been a lot of interest in trying to understand what is the function and role of these nutrients, and also what is the effect of changing the amount of these nutrients that we consume. I think it's really important to continue trying to fund young scientists in a time when funding cuts are making it less and less feasible to pursue research careers. I think sometimes we take it for granted that all of the medicines that we use are born out of multiple years and decades and also multiple people's careers in science and their work. And it often takes multiple teams of people devoting their whole lives to advancing our understanding in a particular field to develop even one drug or one medication. And so I liken it to if we cut down a tree when it's just a sapling, we won't be able to bear the fruit from the tree once it's grown. And so funding young scientists is really like giving the fertilizer, giving the nutrient-rich soil, and helping these saplings to take root so that eventually when these saplings grow into adult trees, we can really make the most of that investment. When I was in high school and in college, I never really understood what scientists do day to day. I kind of imagined that maybe they all sat together in rooms just thinking about problems. But now that I actually work as one, I realized that it takes a lot more than just that. It's kind of like trying to figure out how a car works. Some things are really obvious to start, but some things aren't. For example, when you turn the steering wheel in a car, the wheels turn. Kind of makes sense. But if you press on the gas pedal, the car typically accelerates. So you might think that the gas pedal controls the speed of the car. But if the car is in neutral gear, all you'll hear when you press on the gas pedal is the whirring sound of the engine, and the car doesn't really go anywhere. So does the gas pedal really control the speed of the car? I think this is an apt metaphor for science because we often get things wrong the first time. Things that seem really, really obvious aren't actually obvious when we dive deeper. And so in science, we often get things wrong the first time, and it's all about having the patience and really having the grit to try to more deeply answer questions that we're motivated about and to try to understand what's really going on. It's critical to surround yourself with positive mentors and also peers. I think sometimes in science, we're so focused on improving our resume and impressing others that we forget also that our work is for the common good and that we should lift each other up when possible and to try to share the love and warmth when we can. So, as a dual degree MD PhD trainee, after I finish my PhD, I'll wrap up my medical degree as well. And my ultimate career goal is actually to become a pediatric oncologist. And so I love the idea of working with kids with cancer to try to help better their outcomes and improve their quality of life. And I hope that by having these sort of two degrees, that I can better bridge the bench to the bedside and to try to take some inspiration from the patients that I see to inspire my research to ultimately improve cancer therapy for kids.